Hi, Charlie Lees here from the Edinburgh IBD unit. I've come across to the university today with Sandy, who's the solo cameraman. We are, I think, right now 3 meters apart from each other. There's basically not a soul in the building here, but I can assure you that over in the hospital, the Western General Hospital, which is just a stone's throw over in that direction, there is a hive of activity. It's been an extraordinary period of time. People are working very, very hard, and I just want to give you a sort of little glimpse into what we've been doing, particularly from an IBD side of things. But at the same time, it's an interesting environment, it's an interesting atmosphere. There's definitely a new camaraderie that is emerging across the hospital. I think there is a real sense that we are all in this together as healthcare professionals. The academics and the scientists are offering to help really so many people coming together at this time, and there's examples of that all across society now, I know. But I just wanted to tell you that that's where we are just now. There has been frantic preparation over the last sort of 7 or 8 days. We've done a lot within our own unit to do what we can to virtualize as much of our working as possible. That includes meetings so that we're able to incorporate people who are self-isolating, people who are working from home, people who have childcare difficulties. So that's all happened very, very rapidly. We've virtualized virtually all of our clinic care. So for IBD patients now, we're offering a telephone service. We will move to a fancy telemedicine system at some point, but for now, actually just a really simple phone review with our electronic health records in front of us. And we're very lucky to have a really good, strong team of clinical fellows and registrars that are helping us provide that service, and a wonderfully dedicated, hardworking IBD multidisciplinary team with really particular thanks to our specialist nurses and to the pharmacists who are helping us work through all this. So there's been a lot of reorganization around the hospital. We're having to move our inpatient area, we're having to move our infusion suite, but we're doing all these things to be as proactive and productive as possible, to keep everyone as safe as possible, and to maintain as much core service as we possibly can, so that we can provide as good a care as is going to be possible for people with inflammatory bowel disease, the bit that I'm looking out for at the moment, not just in Edinburgh, but across the UK. And so to that end, at the start of this week, I started a WhatsApp group for IBD teams around the UK, and that's been fantastically productive. We've had a huge amount of constructive conversation. We've managed to come to remarkably clear consensus on what we think the right things are to do are. And I'm separately going to just highlight the sort of top 10 issues of those that we've got as tips for patients that I encourage you to look at, so that we're all really singing from the same hymn sheet there. We're all very conscious that this is a rapidly moving time. Obviously, the epidemiology of the COVID-19 pandemic is shifting on a day-to-day basis. We're doing our very best to follow the national guidance and fitting in with that, and that's shifting rapidly, but we want to make sure that our piece of this fits in with national strategy and global policy where we can. We're in close contact with our international partners, with the International Organization of IBD and the other major organizations, so that we can ensure that our advice is very much in step and in line with what people are saying. We're conscious that this is a new and rapidly evolving area, and I think it's really important that we don't underestimate that. We're learning new things about this virus the whole time. What does it mean for people who have inflammatory bowel disease? What does it mean for the way we treat it, for different medications, et cetera, and just being very careful that as our services virtualize, as we restructure things, that we don't leave people unwell in the community, and so that we can do everything we possibly can to keep people well. Core messages about making sure people stay on their medications, preserving infusion suites, ensuring really good sort of advice around social distancing and, in selected cases, self-isolation, etc. So that's really been ongoing this week. It's been a huge flurry of activity, and I'm enormously grateful to my colleagues locally and across the UK for coming together into such a constructive way about that. We have a consensus document that's with the executive of the British Society of Gastroenterology as we speak, and I hope to be able to share that widely to the all UK gastroenterologists very soon, so that we can all understand what we're working with. we'll aim to have that published in the major journals on their websites at the very least, so that we can make that information widely available to people. So please understand that this will change. It's a fluid situation. I will do our very best to keep you updated with what's going on just now. So for the doctors and the nurses and the pharmacists and all the other members of the IBD teams, please, keep in touch, reach out directly if you have any specific questions, and I'll loop you in with the relevant groups. For patients, please follow the advice that I'm going to give up separately. Please look out for everyone, for families, for patients, for everyone around there, actually, really. Please, everyone can do their bit to make this a bit better. And I'll keep in touch. I'll aim to touch back early next week with an update, and then we can take things from there. Meantime, I'll go back to the daily blog is happening, so you can get some further insights from there. I'll put a link to that there. Going to still call it a daily blog so long as no one's counting the precise number of days. Anyway, I'm going to go back to the hospital. We've got our clinical meeting coming up at 12 to look after our urgent flaring IBD patients. So I'm going to go and look at that situation, and I'll look forward to catching up with everyone later on. Thanks for listening. Bye.